Okay, guys, this is week 5 for the preview of the 5th module: nervous system, endocrine system, and sensory organs. I don't think I've done this one yet, but we're going to go through and get it all handled. I'm looking at 2 different computers, so I'm going to move this a little bit more here so you guys can see what I'm doing. So we're going to go through all this stuff. Now, remember, this is the same thing we did last week, and I want to keep it doing every week. And this is in case you missed the Zoom, which I'm going to reschedule for probably in the afternoon on Monday, because Monday mornings don't seem to be working for people. Now, we have the Zoom recordings seem to be working, so check those out, and we should be okay on there. Remember, the to-do list is the first part. I'll go over those things too with you. The initial discussion post is due by Wednesday. Discussion responses that next Sunday, which is going to be this coming Wednesday is going to be what? Is going to be the 10th. Okay, so the discussion board is due by the 10th, and then by the 14th, which is Valentine's Day, we should have the 2 responses. Now, some of you guys aren't getting their points because you're not doing responses. And if you're doing responses, make sure they're at least a couple sentences. We've said that before, and that's important because you want to show that you're interacting with other people in the class and you understand what's going on. So here's a hint for how to do those. Take one of the terms that's in the original post and give it a definition in your own words. Okay, say, oh, like whatever the senses of the retina. The retina is the part of the back of the eye that receives the light from blah blah blah, and you can just do that kind of thing or something like that. This shows that you actually read it and you went in there. Now it's good to talk with each other, and I really love that you guys are using proper salutations. So you're saying like, hey, Miss Smith or Mr. Jones or whatever it is. I do like your answer because you talked about this, this, and this, and this is how I understood it, and now I know more. That's a brilliant response. Okay. Discussion responses done by 14th, which is Sunday. Online lab gradable case studies 12/2, 13/4, 14/1. We'll do by that Sunday, which is the 14th, and then quiz by this Sunday. And we're getting close to the end, guys. So remember, this is terminology, so we're working more on our terminology things. Nervous system. Nervous system has a lot of terms because some of the terms are also names, and they're weird names like amygdala. Well, that's not a person's name, but we have like Pacinian corpuscles and Meissner's corpuscles and things like that. Those are actually neurological bits. And then we have parts of the brain like cerebrum, cerebellum. Those are very different parts. And we have like midbrain and amygdala, and then we have like oh gosh, there's all kinds of different terms like that we can get into. The interactive lecture, nervous system, sections 1 and 2 and 3. Okay, the eye and the ear. So we're not going into taste, and we're not going into smell, and we're not going into touch necessarily, but we're definitely doing the eye. So the eye, let's go through a real quick anatomical version of that. This clear part right in the front here, that is called the cornea. Okay, so the cornea it means edge or cornice, okay, and it's clear and it's very thin, and light, of course, passes through it. Now, behind that is fluid, right in front of the what's it called? The colored part, which is the iris, okay, and that's a muscular thing that goes like this. It dilates and constricts. Dilate is get bigger, and constrict is get smaller, and that's the aqueous humor. And then we have the iris, and the dark hole in the middle, that's called the pupil. Now you look behind the pupil, there's going to be the lens. The lens is also kind of clear. It looks kind of like a piece of sliced onion. That it's not really clear when you see it in a cadaver, for example, but that could be because of oxidation and the way it breaks down. Behind that is called the vitreous humor. Vitreous means like a little bit thicker. So the uvea, as it's called, which is the word for grape, like uva is grape, and then uvea in Latin is grape. So you have uveitis or iritis. Okay, iritis is inflammation of the iris. Uveitis is the eye itself. Now the white part back here, that's called the sclera. Very tough, very hard to cut, very hard to puncture. And what are we looking at here? Yeah, very hard to puncture. It's a very tough piece. It's very vascular. You can see sometimes vessels, especially if you're tired or you're stoned or you're drunk or whatever it is. And the white of the eye too, the sclera, can become jaundiced if you have a liver problem, and that's because of the buildup of bilirubin. Behind that all is you go all the way back inside the eye. The eye is like a globe, right? And it'll go all the way back. In the back is the retina. The retina is a bunch of tissue, and there's the choroid plexus, and there's chorion, I think it's called. And then you have the nerve cells in there, the rods and the cones. The rods pick up color, or not color, they pick up shades of gray and black, and then the cones pick up color, okay? And then that sends it to a place called the fovea centralis, which is your focal point, and then you have the optic disc, which is where the nerve goes back into the skull, into the brain, okay? That's the optic nerve, which is the 1, 2, 3, third nerve, olfactory, optic, the second nerve actually. Oculomotor is the third one. Oculomotor, oculo meaning eye, and motor meaning movement. Okay. Okay. See, the function of the nervous system too, if we talk about that, is split into two main parts that are again split off. We have the central nervous system, which is the cerebrum, right? This is in the cranium, and then it goes down through a place in the back of the skull, the occiput, and the hole in there is called the foramen magnum. Actually, we can look at it right here. If I can pull this, right, you can't get it off there, I guess. Okay, well, I have a skull. There's the brains. Okay, so the brains, this is the cerebrum. Okay, the cerebrum, top of the skull, this is called the parietal and temporal bones. Temporal on the side, parietal on here, and then frontal in here. There's your brains, or this is the brain, and this is the frontal lobe. This is the front part. This is the top. This is the back, called the occiput. This is the parietal lobe, and these are the temporal lobes in through here. We look at it from the front. We've got two hemispheres, a right and left hemisphere, and these cross over in a place. We can see inside. There's a thing called a corpus, which means body. Callosum means like callus-like. It's tough. It's right in through here. That's the corpus callosum, and it connects the right and left side of the body. We have the brain and the body, actually. And one of the things that happens is all of your functions, or many of your functions, on this side of the brain affect this side of the body. So people who have a stroke, for example, on the right side or left side, if they have a stroke on the left side, it's going to affect the right hand and parts of the brain that manage speech. A stroke is basically usually a blood clot that gets into the brain via the carotid arteries, maybe, or maybe even the basilar artery. In through there, and it goes up and branches around through this thing here. These are all the vascular stuff, and inside there is the circle of Willis. So, cerebrum, cerebellum. This guy down here. This is in the back, right in the back of your skull. The cerebellum is. Oops, I gotta hang on 1 second because I gotta plug my computer in. Okay, my battery was dying, and I didn't want it to die in the middle of what we were talking about. So, central nervous system includes the brain, the spinal cord, and the branches off that are called the peripheral nervous system. And then we have peripheral nervous system sends nerves to like the fingers and the muscles of the hand and all the feet and everybody else. Now you also have what are called cranial nerves, which branch off the bottom of the skull, and they come through the bottom of the brain, and they come through the bottom of the skull and branch out either to the nose or the eye or the face or the neck or something like that, the tongue are common. When there's 12 of those, luckily you don't have to learn them for this because there's a lot to learn. Let's see, our organization, role of cells in the nervous system. There's different kinds of cells that you'll have in the nervous system, and those are going to be things like the neuroglia, and think of glue, nerve, neuro, glia, glue. They kind of help hold things together. It's an easy way to remember it. It's not quite as specific as we'd like, but that's okay. We have things like microglia, epidermal cells, Schwann cells, oligodendrocytes, and astrocytes. Astrocytes, astro, star. They look like stars. Micro, small ones, okay? Oligo means kind of everywhere, okay, or all over the place. Let's see. I'm going through the rest of it here. Role of the cells, central nervous system, the brain, which we talked about, the spinal cord. The spinal cord goes from the brain stem. Okay. Here we go. Again, this is the brain stem down through here. Okay, and then it becomes the spinal cord here, and then it goes all the way down. It only goes down through the cervical spine, right? The cervical and the neck. There's 7 of those guys. Then you go through the thoracic spine. There's going to be 12 of those, and they branch off, of course. And then it ends at about L1. Now, L1, maybe L2, it's called the conus medullaris. The end of it, okay, is the cone. And then it has a little like thing called the filum terminale, which holds it to the coccyx, the tailbone. And there's branches off of that called the cauda equina. Okay, so that's the whole central nervous system and peripheral nervous system in a nutshell. Peripheral nervous system, the nerves come out either through the cervical plexus or the brachial plexus down through here, and they go underneath the arm, remember, underneath the clavicle, underneath the axilla, and come out in the arm here. There's going to have roots and trunks and divisions and cords and then branches. And the branches are going to be things like the radial nerve, which is going to go to the finger. The radius is this side here, and the ulnar nerve down to the bottom. And there's one in the middle called the medial nerve. Okay, down the bottom of the legs, or the bottom of the body, we're going to have the inguinal, the common iliac, and then you have the inguinal, and then you're going to get the femoral nerve, and then the sciatic nerve in the back, and then the tibial nerve and the popliteal nerve, and it goes all the way down the foot to the feet and all that jazz, and then comes back. Spinal cord, peripheral nervous system. Let's see what we got here. Okay, I did that. Now the eye and the ear, we did the eye a little bit. The ear is going to have the cochlea, which I think you guys did something on already. The cochlea is the inner. You have the tympanic membrane, right? So this is called the pinna. The pinna is this part of the ear that kind of moves around, and then you have the lobe down here. And there's different parts, different names all in here. The tragus and the antitragus and all this kind of stuff. Don't need to really know those ones right yet. But we also have the EAM, the external auditory meatus, which is here, or if you're looking on the skull, it's right there. Okay, behind the jaw, there's the jaw opens up, and you can feel, if you put your finger in kind of right in front of your ear, and you open and close your jaw, you'll feel this, which is called the temporal mandibular joint. You feel that, go like that. Now you can see also on there, I do have a couple videos of that, the TMJ, and I do that so that people can do their own therapies and stuff like that. So as we go down, we get to the endocrine system. Let's look at that one real quick. Endocrine system is so if you think of the, where are we going here? There we go. If we think of the activity, bin drop puzzles. Oh, some good pronunciation practice. I like that part of your book, by the way, for you guys. The interaction where you can hear the word and then pronounce it. So really practice with those. It only takes a couple minutes. That way you get those things. It's more important to have the pronunciation of the word, and then you'll understand it better. Okay, so the endocrine system, back to that one, chapter 14, is, where is it? Did I open it yet? Yeah, there we go. The endocrine system is a set of glands. Now there's a bunch of glands. There's the pineal, the pituitary gland and the pineal gland up here on top. There's the thymus gland. There's salivary glands too. That's not really endocrine. Those are exocrine. Exocrine to the outside of glands. Skin glands, like your sebaceous glands, right, or your sweat glands. Those are exocrine, outside. Endocrine is on the inside, and that's what it means. And I think we talked a little bit about the meanings of those words, but we're not really going to worry about that too much. There's also, so thyroid gland is here. The parathyroids are behind it. It's right here underneath the Adam's apple. Okay, the larynx, right, laryngeal cartilage. In here, there's one behind, like behind the sternum, the breastbone, called the thymus. And then we have the liver, is a giant gland. Okay, and then we have the adrenal glands behind there, above the kidneys on the back. And then you have what are called the gonads. The gonads are your either testes if you're male, or your ovaries if you're female. Now they all interact with each other all over the place. And one of the things with the nervous system and the endocrine system is that they do connect with each other. The endocrine system is the slow release. Okay, it takes some time and they release over long periods of time. The neurological ones, very quick. You can release epinephrine and norepinephrine very quickly, or cortisol, something like that. And you get an immediate reaction. Okay, very good, easy on that stuff, right? Moving along. I know this is a lot of stuff, but you guys are killing it in this class. I'm really proud of you guys. Nervous system, okay, reading. Zip through those. Take some notes. If there's words you don't understand, look them up real quick, and that'll help you get it from writing. And one of the best things you can do is write things down. So you have a piece of paper, write it down, and then you can look it up and then write a real quick, it doesn't barely have to be illegible, but as long as you do it connecting brain to hand. Okay, table of contents. I'm going through the modules for you, or with you. Discussion. 2 days later, okay, here we go. So the discussion for this one here, let me read for you real quick. You're working as a scheduler for a busy multi-physician practice. Today, a patient is scheduled an appointment to have the doctor check on her eyes because she noticed he was getting headaches and experienced double vision and possible diplopia. What is diplopia? Di means two, optic, eye. So is she having two eyes? No, she's having double vision. You set an appointment of the patient to see the family practice physician in the office. I would probably go see an ophthalmologist or optometrist, probably an optometrist first. 2 days later, the office manager contacted explained that the patient's condition with her eyes is an ocular disease. Well, of course. Disease, remember, means dis-ease. It's not at ease. It's not working right. She also tells you need to call the patient to reschedule an appointment with the optometrist. Like I said, my brother's an optometrist. He's always on me about wearing my glasses, and I always wear them at the end of my nose. Explain how knowledge of medical terminology would have helped with the scheduling the appointment for the first time. Because you understand what she's having eye problems, and you would understand what an optometrist. If you look at the word optometrist, optometrist means someone who does measurements with the eyes. First one, second one, those kind of things. So you help you fit your glasses and make sure you have the proper lenses so that you can see properly. Explain how knowledge of medical terminology would have helped with scheduling the appointment the first time. There we go. Describe another example other than scheduling a patient appointment when a healthcare professional would need to understand medical terminology. There's many that you can think of off the top of your head. Now, it could be like with prescriptions, getting the medicine, or maybe someone says, could you check their carotid pulse or something like that? And if you walk up and grab their foot, you're in the wrong area. Okay, so understanding as a practitioner or provider as well. Describe the one potential negative effect of patients when healthcare professionals don't understand and correctly apply knowledge of medical terminology. There's people who sometimes have the wrong things amputated, which would be bad. So that's simple because that's left or right? But I mean, you could have the wrong thing. They could say, there was a fracture of the metacarpals, and you'd have to know, is that hand or feet, right? Okay, easy peasy. I think you guys can do that one. Alright, a couple people have already answered it. Very good, very good. Keep it up. Few sentences. Don't forget to do the 2 responses. Get those done as soon as possible. I know some people don't really get to them until like Wednesday, so it's kind of you have to keep going back and forth to it, and that's a real pain in the tuchus. But it does show me that you've contacted that. Boop doop doop. I'm going through. I'm clicking the stuff on the thing here. Online lab case studies, nervous system, endocrine, and sensory organs. Let's look at these case studies. Okay, we're going to go through them really quickly, and then we should be done because this is almost 20 minutes, guys. 17 minutes. Okay. Case study 12.2. Martin comes across a case that needs attention. The chart has been coded with the CVA. That is the principal diagnoses. Okay, CVA. Is it going to ask what it is? The patient was initially seen for vertigo. You got to look up vertigo. Okay, and she led to a fall in her home. The medical history includes TIA. Okay, medical history includes TIA and CVA shortly after the TIA with aphasia and right-sided hemiplegia. Although notation initially rules out CVA, Martin could not find confirmation that a second CVA was the reason for the vertigo and fall. Take the quiz buttons to answer the questions. Oh, so it's going to give you the quiz. So here's some hints on this one. CVA, cerebro. Vascular means blood vessels. Accidents, whoops, right? That's what a CVA is. Now, a TIA is a transient ischemic attack. Transient means it happens intermittently. It comes and then it goes away. It's not a full thing. It may be a lot of pain. They get a head pain or something like that right up in here. That's a very common sign. Transient ischemic. Ischemic means you're not getting blood to the area, and it's like it's tightening up and gets like a cramp. So it's like a brain cramp if you think of it. An attack is attack. So here we talked about also vertigo. Now there's vertigo. There's Meniere's disease. There's many things like this. What is vertigo? Vertigo is a sense of feeling dizzy. And that's a very interesting one. Look it up so you understand the definition of it, because it's a very important one that you'll see a lot. A lot of people get vertigo for different reasons. And there's a lot of cool things you can do to help, too. I mean, there's different little exercises and whatnot. This is aphasia. Okay, that's a good term right there. So some people who have a stroke, a CVA, may have a stroke on this left side, and it will cause problems on the right side. Okay, hemiplegia. is half plegia, not able to move, right? So go ahead and look through that. You should be able to get those pretty easy. That's not terribly hard. If there's any questions, you look them up. Take your time with it, okay? Case number, where'd it go? Oh, let's get rid of that one. Okay, there we go. Dink, dink. Case number 13-4. This is Michael Schwartz, a 79-year-old retired jeweler who's been referred to a plastic surgeon after a routine eye examination with his optometrist. That's interesting. Although he has minor problems with his visual acuity and visual field test. Visual acuity is being able to see detail, okay, in something, and visual field is being able to see out. Okay, that's what your visual field is. His blepharoptosis. Okay, blepharoptosis. Blepharoptosis. It's blepharoptosis. Okay, blepharo, eyelid. Ptosis, weakness, giving him more serious problems with his vision. His optometrist takes a consultation with a plastic surgeon. Blepharoplasty. Blepharoplasty. Blepharoptosis. It's a terrible word. It's one of those words they use just to mess you up, it seems, huh? Case 14-1, here at 20 minutes. Oh my gosh, this is fast. Katrina Wood, a 48-year-old bank manager, has an appointment with Dominica Loh, a dietitian, to help her manage her hypothyroidism. There you go, low thyroidism condition of. Katrina smiles as she looks over the diet that Dominica has proposed and says that she likes the fact that she is supposed to eat plenty of seafood. It's a good excuse to have my husband take me out to seafood, my favorite seafood restaurant. Dominica laughs and replies that the diet includes a lot more than simply seafood, and that she needs to make sure that she also eats lean proteins, whole grains, and fruits and vegetables. She adds that selenium and iodine are also important dietary supplements for the thyroid. Iodine is necessary for the synthesis of thyroid hormones, whereas selenium is used to treat autoimmune disorder, the autoimmune nature of the disorder. Very good. Okay, Katrina asks, so what happens if I go off the rails and eat whatever I want? Dominica tells her that she will have to undergo thyroid function tests to monitor her thyroid levels to ensure that a myxedema or goiter will not develop. Katrina takes notes and asks for any recipes and suggestions for those days she's not eating out. Lean meats, of course, like chicken and fish, right? That's an interesting one. Okay, let's look up goiter. Goiter's a good one. It's very common. Very, very common. Iodine. That's why we have iodine in salt. You see, you look at your salt thing, it says iodized, generally. And they did that because it was a big problem, okay? And then it looks like you guys have week 5 CCMA and CMAA online study guide only for students enrolled in medical assisting or medical office administration program. And it's funny because for me, it says, check this out. This is what it says for me. Okay, no, wrong camera. It says, sorry if this portal is for students only. So I can't even get into it. Wow, man. Leave me hanging. Next to the quiz. We're going to go over the quiz really, really quickly. Let's see if I can get a preview here. Okay, yes. Sorry, this is a long time, guys. This is 22 minutes already. Okay, disorders of sleep-wake cycle. Want to look at the sleep-wake cycle. So if you can't sleep, that's called insomnia, right? Hyposomnia, which is you don't sleep enough. Most of us. Dysomnia, you can't sleep. Hypersomnia, you're sleeping too much. I don't know why is this doing this way? Okay, sensation that may precede an epileptic seizure. Or onset of some types of headaches is termed an aura. Now, people typically think an aura is like the glow that you see around people, and yes, that is an aura. But you'll actually get some kind of like aura sensation. It could be a smell. Some people are like, oh, I smell burnt rubber or something like that. That's the sign that maybe an epileptic seizure is coming, or maybe a migraine. It's very common to see those. Other auras may be visual or auditory, maybe ringing in the ears or something like that. So you can look at those. It's a good one, like headache aura. That's a good one to look up. Rhizotomy is a resection of the dorsal root of a spinal nerve. Well, rhizo, okay, you have to look rhizo and tomy. Tomy is the cut, right? So look those ones up. I'm not going to give you all the answers, man. Okay, inflammation of the iris, ciliary body, and choroid layer is called either uveitis. Remember we talked about uvea means like grape, because it looks like a grape when you cut it. It's really weird. If you cut a grape in half, and you look at the color, the texture and stuff there, it looks like the inside of the eyeball. It's very weird. Keratitis, conjunctivitis, or blepharitis. Blepharo was the lid, remember? Conjunctiva Okay, conjunctiva, that's the covering around here, around the white of the eye. And so look those up, those four different words, and that'll give you exactly what you need to know. Okay, there's an oto, O-T-O, like otolaryngeel, something like that. Visualization of the angle of the anterior chamber of the eye is called the angle of the, oh, that's a good one. You got to write it in there. So now when you write these things in there, when it has somewhere to put the answer in there, make sure that it's capitalized and properly spelled. Otherwise, it gives you no points. So if it's not capitalized, it's a proper noun usually. Okay, glucose in the urine is a bad idea. Glucose in the urine is called diabetes, man. So it's glucose something in the urea. All right, remember proteinuria, hematuria, those kind of things. So use that one. You guys got this. Hormone that stimulates the muscles of the uterus during the delivery of an infant. Ah, okay. So ADH is antidiuretic hormone. Calcitonin also has to do with a hormone from the parathyroids. Oxytocin. Look up oxytocin. It's a really interesting hormone, and PTH is parathyroid hormone. But look those up, so make sure you understand them. Oxytocin is a feel-good love chemical, and the more you have of it, the more people look familiar. It's very interesting. Well, there you go. Here's another true-false question, which you guys can get that one. It's easy. Okay, FPG stands for, okay, you figure that one out. Pretty easy, guys. I think you guys are going to do fine. So just make sure that your stuff turned in on time. And if you're turning in the case studies and it has you fill out on the page, make sure that you're actually filling it out and sending me that, because a few people have sent me the case study worksheet with no answers on it, and that's a 0, so I can't really grade that thing. You guys take care. Keep doing the good work you're doing. If you need anything, let's see you and look for the announcements, okay? And look in the discussions and maybe the cafe. I try to check that one every day, okay? So you guys take care. We'll talk to you guys sometime very, very soon. Probably Monday, I think, Monday afternoon, or maybe Tuesday. We'll see if we can do that, okay? Bye.